This video will review the fascinating stages of fetal development. By understanding these stages, you'll gain insight into the physiological changes that occur from conception to birth. We will cover the pre-embryonic, embryonic, and fetal stages, as well as key milestones, nursing considerations, and patient education. Let's begin. This stage begins with fertilization, where the sperm and egg unite to form a zygote. The zygote undergoes rapid cell division, forming a blastocyst, which then implants into the uterine wall by the end of week 2. Here are the key processes and terms to remember. Cleavage, the division of cells without growth. Formation of the blastocyst, a hollow structure that will develop into the embryo and supporting tissues. Implantation, the blastocyst embeds into the endometrium of the uterus. Nursing considerations. The important nursing consideration during the pre-embryonic stage are the following. Emphasize the importance of folic acid supplementation to prevent neural tube defects. Educate patients on avoiding harmful substances, such as alcohol, tobacco, and certain medications. Now let's learn about the next stage, which is the embryonic stage. This critical stage involves the formation of major organs and structures. The embryo is highly sensitive to teratogens during this period. Here are the key milestones to remember. Week 3, formation of the neural tube, which will develop into the brain and spinal cord. Week 4, development of the heart, which begins to beat. Weeks 5 to 6, formation of limb buds, eyes, and ears. Week 8, all major organ systems are present, though not fully functional. Nursing considerations. The important nursing consideration during the embryonic stage are the following. Reinforce the importance of prenatal care. Discuss the risks of exposure to teratogens and infectious agents like rubella. Provide nutritional counseling to ensure adequate intake of essential vitamins and minerals. Moving on to the next stage, which is the fetal stage. The fetal stage begins at week 9 and continues until birth. This stage is characterized by growth and maturation of organ systems. Here are the key milestones to remember by trimester. During the first trimester, which spans from weeks 9 to 12, the fetus grows rapidly. External genitalia become distinguishable, and the kidneys begin to produce urine. During the second trimester, which covers weeks 13 to 26, the fetus's movements, also known as quickening, are felt by the mother. The skin develops lanugo, which is also known as fine hair, and vernix caseosa. The lungs start producing surfactant by week 24, which is crucial for breathing after birth. During the third trimester, which are weeks 27 to 40, rapid weight gain occurs and fat stores develop. The brain and lungs continue to mature. By week 37, the fetus is considered full-term. Nursing considerations. The important nursing considerations during the fetal stage are the following. Educate on signs of preterm labor and when to seek medical attention. Encourage regular fetal monitoring, such as ultrasounds and non-stress tests. Discuss the importance of maternal nutrition, including protein, iron, and calcium. The main focus as a nurse is to promote maternal health, prepare the mother for birth, and support her emotional well-being. Let's talk more about promoting maternal health. Here, you will want to encourage prenatal visits and adherence to recommended screening tests. Educate on managing common pregnancy symptoms, such as nausea and fatigue. Prepare for birth. Here, you will provide information about childbirth education classes. Discuss the signs of labor and what to expect during delivery. Support emotional well-being. Offering resources for managing stress and anxiety during pregnancy. Encourage open communication about concerns or fears. Understanding fetal development is essential for providing comprehensive care to expectant mothers and their babies. By recognizing key developmental milestones and addressing maternal needs, you can play a crucial role in promoting healthy outcomes. Well, that ends this video. If you found this video helpful, don't forget to leave a like, a comment, and subscribe for more nursing reviews.